Here at Frantz EyeCare, there's a team of experts who care about your health. And now is your chance to get to know these medical professionals with Ask the Experts. So let's catch up with Dr. Jonathan Frantz and Dr. Maxwell Burch as they explain corneal eye disease.
As a multi-specialty practice, sometimes there are people who have issues that go beyond just cataract. So more than just the cataract is affecting your vision. Maybe it's your retina, maybe it's your glaucoma, maybe it's irregularity on the front of the eye called the cornea, or something else. We have specialists in each one of those areas so that we can have you seen by that person, get the appropriate testing, and do things to maximize your potential vision after surgery. The eye is incredibly specialized. Depending on what part of the eye you're working on, it is so different in terms of the way it's cared for, the skill set, the surgeries, everything. And so, for example, someone who specializes in corneal surgery, corneal transplant, has a very unique skill set. And one of the things that we know is you can't maintain a good skill set if you're doing 1 or 2 procedures a year. So we maintain that specialty, and we also maintain all of the latest technological advancements in terms of imaging and diagnostics. Corneal disease is a very common cause of vision loss.
The main things that a cornea specialist gets extensive training in are transplants and refractive surgery. Transplants are due to various reasons, some scarring of the cornea. Patients with keratoconus, when they get into the end stage of that disease, they do need a cornea transplant to improve their vision. The partial transplant that we perform is most commonly used for Fuchs endothelial dystrophy. The Fuchs dystrophy affects the inner lining of the cornea, and eventually it stops working as well. The cornea gets swollen, vision is unable to be improved by glasses, and so we have to replace that layer. The refractive component of a cornea specialist, because we have spent additional training in conditions of the cornea, how they're supposed to look, we have a little more experience in making sure that patients are getting the best outcome, making sure that it's the right candidate, which is always important when you're choosing surgical options. As a cornea specialist, I also deal with surface diseases. The most common that I see is pterygium. Pterygium is a growth of the skin that covers the eye, and it starts to grow onto the cornea, and it can affect the vision. Cornea specialists have additional training to make sure that that procedure is done with minimal scarring and little recurrence. Surface cancer is another thing that cornea specialists have extensive training in. There's skin that covers the eye just like there's skin everywhere else. So people who are out in the sun a lot, especially here in Southwest Florida, they can develop skin cancer on the eye. And we are able to treat that and remove it so that it doesn't cause further problems.
So having newly trained people who that's all they do gives us a huge advantage in terms of being able to provide the best care.
Frantz EyeCare, creating better vision for a better life.